So complex regional pain syndrome, or CRPS, is a disorder of the nervous system, and it creates a type of abnormal nerve pain or neuropathic pain. Complex regional pain syndrome is a new name for a disease that was described around the Civil War period. At that time, a physician had noted that some of the troops were coming back with bullet wounds to an extremity, and rather than healing from those, would have a pain condition that spun out of control, was intractable pain, had swelling, color changes, to the point where they couldn't even touch it. Amputation didn't help, typically would even worsen things. Initially, when it was discovered or described, it was called reflex sympathetic dystrophy or causalgia. And reflex sympathetic dystrophy is when a patient has this condition due to some sort of injury to tissue in general. You can also get it from a specific injury to a nerve, and that was called causalgia. So those terms are still used some by people because they're old terms that people are familiar with. It was renamed by one of our associations to better describe the way the disease worked and sort of the underlying processes by being renamed complex regional pain syndrome. And it's called CRPS 1 and CRPS 2 for reflex sympathetic dystrophy, and causalgia, the old terms. So the most important thing to know about this disease is that it is not a disease of the area of injury. So for example, if somebody has an injury to their foot and develops complex regional pain syndrome, it's not a disease of the foot any longer. Part of the disease process is due to what we call receptive fields. And you have those locally in the foot where you get a spreading of pain to surrounding areas. But also the way our nervous system is wired, when you have pain, there's certain regions of the nervous system that ramp up. That's part of the normal functioning of the spinal cord and brain, is to ramp up so your pain response is actually increased. And if you think about it, that's adaptive. If you have an injury, it's important that you protect it and avoid re-injuring it. So having sensitivity like you do after getting struck with something in the hand or burned, where the whole area gets very sensitive, it's adaptive. It stops you from re-injuring it and overusing it. So that's a normal function of both the nervous system peripherally, as well as the central nervous system, both on a spinal cord level and a brain level. When that sequence of events spins out of control or exists and continues to amplify past the period when it should be recovering, is when you have abnormal nerve pain or neuropathic pain. So it has to do with the processing of the information. So you get sensory input from an extremity, but the way it's processed by the central nervous system, it's perpetuating itself and worsening instead of improving. And that's one of the reasons it's so difficult to treat, and why we choose the type of treatments we do. It's because you can't simply treat the foot. We do some things locally, but to stop the constant influx of sensory information, but you have to do things that affect the abnormal nerve processing on a spinal cord and brain level.